down the pavement to the Strathmore Student Center, one of our kind of incubators. To see the irony, because innovations are ideally supposed to make healthcare cheaper. They are making it more expensive. That's a really important thing to note. The fourth thing, and I'm moving towards the end, to note is we now have scientific evidence showing the potential impact of some of these innovations. We've done a lot of pilots. We've done a lot of small-scale rollout, and we are generating really interesting evidence here within the business school and other institutions that clearly shows the potential impact, if modeled at population level, of some of these innovations. So we have the solutions. But now the fifth thing that is happening, and that's a damper, and is the reason we're here, is the guys who've been funding us and would have probably helped us buy these things are closing shop. So you have all these cool things happening. You have growing demand. You have complexity of diseases. You have evidence showing innovations work. And then the guys who a few years ago were paying for a third of your budget are pulling out. What does that mean? That's why we are here. Africa needs to step up now. And these conversations are really important for us to start having. Who steps in to ensure that these resources are used optimally? Do we continue working in public sector silos, in private sector silos, because somebody else is paying? Or do we sit back and recognize that, wait a minute, we actually have to use the limited resources we have to provide more care, to purchase more complex innovations, to invest in systems that were not designed for today, and to serve a growing, agitated, young population that is ready to take to the streets. So ladies and gentlemen, that's why we are here today. And as we start these conversations, we are going to do this, Doreen kind of laid the roadmap, but the first thing we're going to do is, again, we'll just dig back and look at this, the scale of the challenge that we are talking about, the task ahead of us. The second thing we're going to do very quickly is have a panel discussion that's now looking at what are some of the emerging solutions that you're seeing and what's the potential that we have within this room and within this country and within this region to solve our own problems. And then we finish the day in the afternoon by charting the way forward. Another panel that is specifically looking at curating all these discussions that we've actually had. And I'd like us to have a commitment as we are walking out of this room today on how we are going to do that better. This is the first of a series of conversations that we hope to keep having. And we really, really look forward to an engaging and productive conversation. Now I remove that hat. Allow me to now welcome my executive dean. He's a tall figure, both literally and figuratively. He's a mentor to a lot of people here. He's very passionate about health systems. He's always stopping me in the corridors and asking me random questions that half of the time I can't answer. And he's been kind enough to actually come here and open officially the session for us. So Dean, karibu tafadhali.
Thank you very much, Professor Frank. I think this microphone was set for you, not for me. Yeah, Frank said that I'm a tall fellow. Actually, someone emphasized that I am tall and thin. Yeah. Thank you. This guy is quite innovative. Yeah. So, good morning, everybody. I am so delighted to be here this morning, and I am very proud of the work that Frank and the team at the Institute of Healthcare Management does here at the business school, and always happy to engage in this space of healthcare management for one reason. Every week, I receive requests to fund people who are in hospital. And I'm sure many of you do the same, isn't it? And I think he talked about some of the issues of costs and rising in the space of healthcare, and many people really struggling, many people. So it is an issue which is very close to my heart, as I'm sure it is so close to your hearts. And I want to thank the organizers of this forum, because it is so timely. It is so timely. The whole idea of sustaining and improving our health gains in the face of donor transition is spot on. So thank you very much, Frank, the team, and all the organizers, all the stakeholders. Thank you so much for coming up with this forum. I want to just make a few remarks as we open as you start this forum. And as I mentioned, it is very close to my heart. Number two, we have a vision here at the business school, and as a university, the university was set up as a service to society. And the business school specifically identified the need to spearhead Africa's transformation